I'm Adam Hendriksen, and I'm a medical technician at Los Angeles Air Force Base. I work for the only female provider in Los Angeles, so due to this reason we deal with a lot of women's health concerns. One of the greatest concerns couples have is what birth control do we use? With you and your spouse or significant other have so many options out there, from condoms to vasectomies, from diaphragms to tubal ligations. How do you choose what is the best birth control for your situation? The birth control I suggest most often is the Nexplanon, which is a subcutaneous or under the skin injection that's placed in between the bicep and tricep area and the superficial tissue here. It prevents pregnancy for 3 years. After being thoroughly numbed with lidocaine and epinephrine, you have the device placed with this applicator here. It's significantly pain-free and one of the long-lasting birth controls. It is non-vaginally placed. It doesn't require you to remember to take it every day, and it has the chance of reducing or getting rid of your menstruations altogether. According to RelayHealth.com, at the age of 21 years old, you require a pap smear, and with normal result, you require an additional pap smear every 3 years after that. This is a lot of pelvic exams throughout your lifetime. This birth control, as I previously stated, is non-vaginally or cervically placed, so it reduces the amount of pelvic exams required by the other intrauterine devices. Ultimately, you and your partner will be more comfortable, because I don't care how many times you've had a pelvic exam from a provider, it is never comfortable. And ultimately, if you have a history of abnormal pap smears, it may require that the intrauterine device be removed to be treated, which is not good because now you have the risk of getting pregnant. And now that your vagina isn't being turned into an observatory, the second reason that I think this medication is above all others is that you can't forget to take it. The pill is once a day, the NuvaRing is replaced once a month, and the Depo-Provera shot is in a 3-month time span in a specific window. The IUD is also hard to verify, and the Nexplanon can be felt and verified by you or your partner at any time. And as I previously stated, the Nexplanon lasts 3 years, which is not even the best reason for this particular birth control. According to the FDA, you or your spouse has a 55% chance of reducing your menstruations down to 3 days, light spotting, or getting rid of your menstruation altogether. With the absence of menstruation, you can save $1,120 a year in women's health products. And ultimately, with the reduced menstruations, you're no longer restricted in activity between you or your spouse that 1 week out of the month. Men and women can appreciate this fact. And ultimately, if you have negative effects from this particular birth control, it can be removed as quickly as it was placed. The Nexplanon is not just a birth control. It brings couples together without fear, time constraint, or doubt that the medication is working. The non-vaginal placement of this medication, the memory-free use of this medication, and the chance to be menstruation-free are great reasons for this particular birth control. I would even argue that these 3 things alone make this the birth control of the future. If you still doubt me, ask your physician or go to www.nexplanon.com and look for yourself. You'll find that the risks are very similar to other birth control methods. Make Nexplanon your birth control choice and live without periods in your month, periods in your relationship, and periods in your life.